about you is that were you were eating the right things. You exercise.
Yeah.
By looking at you, I can tell that you're absolutely stunning. You take care of yourself. But you were going to doctors and doctors and doctors. What kind of doctors do you go that were like saying you're fine, like what?
I had gone to an ear, nose, and throat doctor. I had gone to a cardiologist. I was getting ready to go to a psychiatrist, in fact.
Mm-hmm.
It's just, and I had gone to dentists and good dentists, and they were telling me I needed root canals, and I just couldn't do one more, and my head hurt, and I was even going to ask to be referred to some kind of brain specialist because I was having excruciating headaches, and I couldn't hear out of my left ear, I couldn't see out of my left eye. The eye doctor told me that I had severe pressure on my nerve going to my eye, and she couldn't figure out why. And
She never even occurred to her to look, because you had the infection right there on the left side.
Yeah.
And you had the root canals
Mhm.
and the teeth that were infected on the left side. So none of those doctors.
no, I'd had a
occur.
CT scan. They didn't see anything. They were all, and I had just basically given up until I read your article in that newspaper.
Yeah, the Natural Awakening.
And I thought, I need to try one more thing, and I can't think about another root canal. I just can't do that. I couldn't blow my nose. My throat hurt most of the time. I was losing my balance. I thought I had a brain tumor. I really did. And
because it was on your head. The teeth that were infected and the metals, you had mercury, you had heavy metals, aluminum.
It just kept getting worse. I was in nutrition for years. I was in charge of a nutrition program for a school district, 12,000 meals at lunch every day, 7,000 meals at breakfast. I knew nutrition. I lived nutrition.
And you look nutrition. You look so healthy.
I had been in dietetics, and I knew what you should eat and what you shouldn't eat. I loved exercise. Jane Fonda was my idol.
Yeah.
And Denise Austin, all
Right.
those guys, all
Right.
those ladies. And so I'd exercised all my life, and I was losing the ability to ride a bicycle and focus on moving my body. And I thought, I need to try one more thing, and if they don't find anything, but I feel so much better. It is just, it's amazing. It has been a year-long process, but I do feel myself coming back because I do know how to eat. I do know how to exercise. I knew how to take care of myself, but what I was doing was not.
Well, what you were doing,
anymore.
Martha, saved your life.
Oh,
Because you were doing the right thing in a toxic environment. So when you have a foci, they call it a foci of infection, that is going to debilitate all the organs on that electrical circuit that's called a meridian. So because you have multiple foci, it was affecting different organs. Like on the left side, that tooth that was under the eye. And so tell me about the things that you have felt improvement after. I know that the next day you were crying because you could actually breathe from your left.
I can breathe. My eye feels like it can focus. I can hear out of my left ear. When I blow my nose, snot actually comes out. And it just, it feels, my left lung and my heart seem to be the last things that are coming back. But as I do meditation and yoga and focus on my breathing, I feel my breath's coming back and my heart is calming down.
Now, you told me the next day, and I didn't know this because you didn't disclose that on the examination, that you couldn't swallow on the left side.
Right, I couldn't my left I couldn't swallow on my left side, and again, that's why I thought I had a brain tumor. It was just going downhill. In fact, my husband even said, he says, I didn't realize how bad you felt, but I knew you weren't you anymore. So he's seeing me come back. He sees the energy coming back.
Right. Well, you look absolutely stunning.
Absolutely.
We have photos of you before. You look 10 years younger. If that's possible.
I've lost a little weight, but I think that's because of the infection weight. It hasn't been muscle weight. And because, see, being in nutrition, I know the difference between fat and muscle weight. And I've still been doing weights and things like that. And
You have a different glow.
And your eyes are clear.
My eyes are
sclera is white.
My eyes are clear. My breath seems to be so much better.
I would say.
Because, I mean, for years, 20 years,
Yeah.
I've dealt with that. And
because you had the root canals and the teeth were rotting underneath, and the jawbone was rotting underneath, and all that was giving you halitosis and also infecting the bone and the gum. And then you had an electrical reaction between the metals that you had. You had a combination of dissimilar metals like mercury, aluminum, lead, a plethora of things that were under those crowns that were porcelain fused to metal. They put aluminum on the porcelain. So, that creates brain fog, the fog on your brain. So everything you're telling me for us is what we see every day. So I thank you for trusting us because, when I told you what you needed, you went for it.
well,
You went for it and you trusted us, and, it's being a beautiful. We are so honored that you trusted us because you being in the health, you can help other people, sometimes realize they're looking at the wrong or going to the wrong doctor.
Oh, it's just, I look at my friends who've had issues, and I just think, oh my gosh, the first question I ask anymore, I said, have you gone to a holistic dentist?
Right.
What's your teeth like?
Right.
I go,
Right.
well, that's kind of invasive, Martha, but
Yeah. No, but you might save somebody's life.
Honestly.
Like literally.
it's just,
Like people tell me, I wish I knew about you. Nobody told me about this. So people find us through word of mouth, or maybe they heard one of our podcasts, or they were desperate and read an article and they say, what do I have to lose? But
that's basically kind of where I was.
We've been through a lot together for over the past year.
Yeah, I was looking at the calendar the other year, and I thought, from last year, and I'm thinking, I cannot believe how much better I feel this year.
Oh, yeah.
Than
Even with the
this
COVID
year.
scare and the stress and all
that's
that.
minor.
Yeah.
it's minor
Yeah.
compared to what I was dealing with last year. I'm thinking about October, the middle of October, I came to you, and thank goodness, because I was at my last
I remember
stand.
you told me that the doctor said it was in your head.
Yes, he told me it was in my head.
And he was right. It was right in your head.
Yeah,
All
he was right.
infection was on
but
the
he said,
head.
I don't see any. I mean, I'd had the ear and nose scopes. I'd gone to the eye doctor. I'd gone to the ear, nose, and throat guy. I'd gone to the cardiologist. I'd gone to my regular doctor and ran blood tests. And I was beginning to think that I was, and they were ready to put me on antidepressants. And I said,
Right.
I'm not depressed.
Yeah.
Not yet, but you're going to make me be.
Yeah. Well, I'm so happy that, God led you here because,
Me too.
I know that God leads the people here. And my prayer is that if anybody's listening to this podcast that we're doing right now, that if they have not gone to a biological dentist, that they will consider that if they have any root canals, for them to watch Root Cause in Tubi. It's a free app that they can download and watch it and see if they can relate to it. Because on a daily basis, we do surgical procedures, and we see the next day, like the patient this morning, she was saying, I cannot believe that at 79, I have been going to all these different doctors, and it was in my mouth.
Yeah.
So, our hope with educating people and doctors and encouraging doctors to never offend somebody, telling them it's in your head, you need a psychiatrist, you need antidepressants, because you don't know what it is. You don't tell that to a patient. What you have to do is say, I don't have what it takes to fix your problem, but let's look outside the box of my box. My box is ear, nose, and throat. You're complaining about something in your head. Let's consider a biological dentist. Somebody that's going to check the connection of the roots to your eyes, to your ears, to the joint, to the body, to the heart. Yeah. We have a lot of patients that come with infection, that the infection is going to their heart, and then they're being diagnosed with endocarditis. Well, no, the heart is not the problem. It's in the mouth, and it's going to the heart, or they're getting asthma and bronchitis from the bacteria that go into the lungs. Now with COVID, people cannot afford to have an infection in their mouth.
No, they can't. And I'll have to say this, that it seems like women, maybe my age, which is 68, we have a tendency that after we've had our children and everything, to kind of let our bodies go. And I see a lot of my friends do that. And
but you don't do that. You look fantastic.
No, but if ever you need to take care of yourself,
it's then.
It's now.
Yeah.
It's now.
Yeah. Now is the time.
Because you're older and everything else is beginning to fall and crumble. You need to really take care of yourself at this age.
Yeah.
I mean, when you're young, you can bounce back, but when you're,
You would be surprised. We have young patients here. We have a lady that is an influencer, and she's in her 20s, and she had a root canal that was eating her jawbone, and it was causing acne. So she came, and because she influences young people, we have a lot of young people just like you in their 20s with infections like yours, already having problems with the heart and the lungs and the stomach and the biofilm. And so we're grateful to her because, usually the young people, they go to online and Facebook and Twitter and things like that. So we're having a group of young people coming. So age has nothing to do with it. I have people in their 20s with advanced periodontal disease that the infection has destroyed the bone and they need all the teeth out. So imagine that. You have your teeth and you're 68. So we have people in their 20s. So it's a matter of education. I wish that when we were locked down, the media would have taken that opportunity to educate 250 million people watching TV.
Well, it had been a perfect opportunity with COVID.
It would have been perfect.
With the concentration on health and your immune systems.
Right.
And I was reading an article last night, in fact, in this AARP magazine about how you need to bolster your immunology and your immune system. And it didn't say anything about dentistry. And I was kind of disappointed.
That's right. You're going to be the voice. The voice. Because most people don't think on those terms. When we go to dental school, we go to medical school with the doctors. But we become experts of the head and neck. So we are very well aware of the connection of the teeth and the impact on the heart, endocarditis, bacteremia, asthma, all these different things. But what happens is that what I have noticed is in medicine, people become specialists, and then they forget about the whole body. And that's where the term holistic comes into play. Holistic means that you're going to see the person as a whole. So when I see you, I prayed with you. I was supportive emotionally of your emotional needs, because that's important too. You want a carpenter that's going to make your house, but you want the person to care, to support you spiritually, emotionally, and then know the connection and be able to guide you. Now, in your case, you're an expert nutritionist, but a lot of people, like yesterday, I had a new patient, and she came here for advice on diet after I removed the mercury, because she is aware she's a nutritionist herself, but she doesn't know that much in terms of the mercury. So I had to say, listen, first let's get the mercury out, because right now these are the things that you cannot eat.
Right.
And she was like, what? I say, yeah, because you pull the mercury into your brain. So, you know, there are certain things that you don't want to take or use, like oregano, because oregano will pull the mercury into the brain because it crosses the brain-blood barrier. So, you know, there's so much that, you know,
All
that
kinds
we
of
can.
information
But
we
anytime that you have a friend, I encourage you to not be bold, because maybe you're the only person that they're going to, like, have that aha moment. Oh, I never, you know, thought about that. And you might save their lives.
Very true.
Yeah.
Oh, everybody, all my friends know about this.
Yeah.
They all
That's
know.
wonderful.